Good evening, everyone. Welcome back to another educational night. Good evening, everyone. Welcome back to another educational night brought to you by Al-Ayen University Medical Educational Unit. Tonight, we have one of the most inspirational doctors with us, Dr. Mudher Al-Khairalla. Dr. Mudher is a consultant respiratory doctor. He's a practicing physician at Nasriya Teaching Hospital. Dr. Mudher will talk about how to approach to a clinical case. I'm super happy and excited to join tonight with all of you, and very much looking forward to Dr. Mudher's speech. Dr. Mudher, most welcome. The floor is yours.
شكرا جزيلا. Thank you kindly عزيزتي أمنية، وشكرا جزيلا لحبيبي مبارك وعمر وكل الكادر الطيب اللي made this become a reality with digital library اللي هي بدأت بالحقيقة تنتشر بأنحاء العالم. We've had very positive feedback from all the colleagues who have contributed to this platform, inshallah, and I hope and wonder whether this will be something much bigger in the future, inshallah, with an outreach that will stimulate and inspire many of our colleagues, junior and senior. I will share the screen, inshallah. That's the share, and I think a slideshow present. Sorry. بس خل أحرك هاي. Sorry guys. Slideshow. Start. إن شاء الله تشوفون السلايدات إن شاء الله. Yes. إن شاء الله. ممتاز. Okay. So welcome. This is a topic that is close to my heart, to be fair, and the reason why it's close to my heart is because it is a topic that has been almost pioneered from the scratch by educationalists at the University of Dundee, which is the university that I graduated from and I trained in, and I continue to be an honorary lecturer for. Dr. Omnia kindly introduced me with her kind. So I do teach in both Iraq and work in Iraq, and also teach and work as an honorary lecturer for the University of Dundee and University of Al-Ayen Medical College in both the UK and Iraq. So welcome everybody. And so this is a platform, this is a topic that is, as I said, close to my heart, because it's something that I have seen and benefited from greatly in my career in medicine and my training years as well. And the reason why it's such an important topic, it's an introduction to an element of training and teaching that inshallah will be introducing at Al-Ayen Medical College, and I hope that it will be something that we can replicate in other colleges. The problem-based learning is the clinical approach to a case. And you'll understand what I mean by that as I progress in my talk. Inshallah, اليوم we will be giving the introduction. What the role of the clinician, because that's what we train to be when we go into medical school. Overview of the problem-based learning. I'll only be touching the surface. شيء كل الشرح مبسط إن شاء الله. I want you to enjoy it, absorb it. It will probably become a lot more detailed as you progress in your years at Al-Ayen Medical College, and of course those who would benefit from the concept of problem-based learners, particularly people who are into the realms of medical education. And then at the end, inshallah, we will leave you with some take-home messages. So the first question, what is the main role of a doctor? And I've put main rather than the sole role, but the main role of a doctor. It's a question that we often ask ourselves, and people are not sure why they've chosen medicine. What does it mean to be a doctor? And it's not a complicated question. I'm not looking for something deep and meaningful and philosophical at all. I find that sometimes when we see our patients who, for example, مثلا يجي مريض who says يقول مثلا أنا ما تحسنت، دكتور ما تحسنت. We have a two-tier system in Iraq. So we have state-funded institutions that are relatively poorly funded. There's a lot of dysfunctional component to them, some mismanagement, etc. So people don't really have a lot of trust in them. And then we've got the private sector, the second tier, where people go out of pocket to spend their money, etc., to see doctors. And what we see اللي نشوفه احنا انه هوايه من طبيب من المرضى العفو يجون بالبرايفت سيكتور on the second tier system بس لانه ماكو filtering process or it's out of pocket, so they have the freedom to jump from one doctor to another. And the reason why they jump from one doctor to another, because if they don't get better or they have a suspected serious illness, then they keep jumping from one doctor to another when they don't get better. They make the assumption that they're not better, ما تحسن الدكتور, because the doctor hasn't found the right diagnosis. Where in fact, that's only one possibility, and it's usually the unlikely possibility, and I'll go back to this. It could be that the patient hasn't been taking their medication adequately or appropriately, وهي أكل بدون أكل, or the technique is impaired, injection site, inhaler technique, for example, interaction with another drug. There might be another diagnosis, as we mentioned. There might be an additional diagnosis. It might be the disease severity. All of these things and all these components don't necessarily come across to the patient's mind, and they think that rather than being patient to see through their treatment, they will jump from one doctor to another. فمرات من يسألوني المرضى مثلا يقولوا لي فهيك مثلا أو يطفر أو ما متأكد وهاي، نسألهم شنو شغل الطبيب؟ الأسئلة الأجوبة اللي تجيني اعتيادي يطيب الناس، يجيني إنساني. It's all non-specific. But the actual accurate answer is to diagnose the patient. يعني إحنا تدريبنا للأطباء as undergraduates and as postgraduates, the main component of it is to diagnose the patient. Because if you can't diagnose the patient, you can't do all the other components of what makes you a doctor. فمثلا, being a diagnostician is so central because based on that, if you don't have the right diagnosis, you might be a brilliant learner, you might be a brilliant researcher, you might be a brilliant care provider. بس إذا مثلا واحد شخص مثلا TB pleuritis, tuberculosis مثلا, تدرن بالرئة, والمريض عنده carcinoma, they might be a brilliant care provider, they might be a brilliant communicator, بس على قولة الإنجليز they're barking up the wrong tree. يعني هو مشتبه وهو الدايجنوستس غلط. فالسنترال ثيم لازم هو تشخيص المرض, diagnostician. وبين واحد يصير هو brilliant diagnostician طبعا, يبدي بجوانب الأخرى is what makes a doctor. A good communicator, a good decision maker, a good care provider, a good learner as the years progress, مثلي, a good researcher to ask the questions that no one knows the answers to, and a good manager when they want to develop healthcare reform and systems that are productive and streamlined to deliver the best care to our patients. Teaching methods in medical schools for many, many years were traditional. And now we're seeing more and more مستحدثة, contemporary teaching methods coming into play. فأتذكر we were the second year to go through the integrated teaching system, the problem-based learning, etc. etc. كنت أنا خايف من هذا الموضوع لأن كنا نجدد لهذا الموضوع. كنت أنا طالب كلية الطب أول ما بدأوا هذا الموضوع. But in hindsight, I am so pleased that that's what they did because it made me understand diseases a lot better. المفروض إحنا when we teach our trainees to become good doctors with all the attributes that I mentioned earlier, doctors that are very good at making diagnoses, but what's also important أنه from the word go when they graduate, it's relevant to real life. يعني هو مو يحكي فد شيء وعنده فد شيء ينظر اكو فد معلومات small print بالكتب, لا لازم اكو real life و relevant to the scenario at hand. راح يحسها المريض, يحسونها ذوي المريض, يحسونها زملاء الطبيب إذا الواحد هو they're not focused on something that is relevant to the patient's case. فمثلا من يجينا احنا كان يذكرني اسمه traditional teaching methods, يروح الطالب بالكلية يدرس باثولوجي، ويبلز ديزيز، باركنسونز ديزيز، فلان ديزيز. بس بعدين من يجي المريض ويسأله، المريض ما راح يجي يقول له what symptoms do you have. الطبيب والمريض يقول له I feel a pneumothorax doctor. مستحيل صح؟ المريض راح يجي ويقول I feel breathless doctor. أنا فحطان، عندي قحة، أنا عندي سخونة. فش اكتشفوا أنه ويا مرور الزمن بالتراديشنال تيتشنج من يقولوا له نيوموثوركس للطبيب التو متخرج، يسطر الكتب، يفتح الانسايكلوبيديا مالته ويطلع طبيبة والطبيبة كل اللي موجود what they hold in terms of information and the details of the information in all the details that is necessary. But then they found that although they carried all that information, there was a transition when they graduated that was missing. They know a lot about the disease, but they don't know how to pick up the disease from the patient. هاي كانت المشكلة. لأن هو مثلا يجي المريض يقول له فحطان، أوكي، ما راح يفكر أنه ممكن ربو، ممكن heart failure، ممكن ما أدري شنو. So the medical educationalists, what they felt was appropriate أنه okay, traditional methods هواية منعتهم حلوة ولطيفة وهاي, and that's not a problem. But there's core medicine, common diseases, common scenarios that all doctors should know in a good amount and fair amount of detail. هذني should be the focus of problem-based learning حتى يكونون هم a productive doctor that can make a diagnosis early in their careers. فمثل ما قلت, learning pathology كان الفocus with traditional teaching methods, and then learning clinical presentations with some focused learning pathology is the new contemporary way of teaching medicine. And احنا كلنا نعرف انه الطب مو بس بحر، محيط بالحقيقة. And it's an expanding ocean, it's an expanding universe. فمعناها شنو؟ مثلا أنا هسه respiratory physician, but I also have specialist interest in interventional stuff within pulmonary disease, pleural diseases, allergy وasthma. كنت فترة lung cancer lead بساوث يوركشاير. فهاي كل هالأمور شنو معناها؟ تخلي الواحد يعرف ويكتشف أنه بدأت تصير حتى هي within the same speciality, بدأت أكون niche aspects of every speciality that expands so much, بحيث أنه الطبيب لازم يكون واقع ويا نفسه. مستحيل هو راح يتعلم شكو باثولوجي موجود. ولهذا السبب هو مرات من يبدأ الطبيب يطور نفسه and they start progressing in their years, they're coming towards their final years, there's no way they can read يعني books from cover to cover and memorize all that information, and it's pointless memorizing it لأنه عنده Google, عنده resources, عنده library. What's more important is extrapolating that knowledge and applying it in real life. When we graduate, there are tools of the trade. أكو عندنا إحنا weapons and armory that we have at our disposal, and I can't emphasize it enough. It is taking the thorough history when you first graduate, a thorough examination of the patient, bedside tests including vital signs, your pulse rate, which could be part of the general examination, your temperature, your respiratory rates, your saturation probe, urine dip. Sometimes people consider that as vital signs, the conscious level of the patient. All of these things, يعني, they are the tools to somebody who has just graduated. They've got a lot of learning to do still, and they possess the tools to gather the information. وبعدين, and that keeps them safe لأنه they still don't have that experienced eye. They still don't have that ability to easily extrapolate the information. أنا ما أحكي بس عن طلاب كلياتنا هسه، أنا أحكي عن نفسي وكلنا إحنا، لأنه ما حد يطلع من بطن أمه يفتهم ويعرف كل شيء. لازم أكو مرحلة معينة من التعلم. But it's important حتى الواحد keep yourself safe أنه عنده this tool of the trade, and never forget this tool of the trade. That's crucial because it will give you the answer maybe 85 to 90% of the time. Another aspect that you learn as time progresses, and after you start developing this tool in medicine of learning how to admit the patient, clock them in, assess them in a very extensive way, then you start balancing. يجيك مريض فنسميها احنا Occam's razor versus Hickham's dictum. And these are Latin phrases that have come. I've put a little bit of the slides that are here for people to look at, and I'm not going to dwell on them too much, but it's basically إذا يجيك مريض عنده أعراض هواية، هل أكو unifying diagnosis؟ هاي يسمونها Occam's razor. يعني واحد يقول مثلا عنده سخونة، قحلة شوية دم، عنده pleurisy، يكض صدره من ياخذ نفس، وبعدين طلع عنده clot برجله. فهل هاي unifying diagnosis Occam's razor بيها موجودة أو Hickham's dictum؟ In this scenario اللي أنا أعطيتكم إياه is Occam's razor لأنه البلوت clot ممكن تروح للرئة. It wedges into one of the subsegments of the رئة مثلا, then you get a pulmonary infarct, dead pieces of lung. This then gets infected, which gives them the temperature, the coughing up blood, and etc. etc. But there's a unifying diagnosis of venous thromboembolism with complicated by pulmonary infarct infection. هاي يسمونها unifying Occam's razor. بس الطبيب الحاذق اكو مرات تجي انه المريض is allowed to have more than one explanation to their symptoms or more than one disease at any one time. ويمتى هاي تكون مهمة ويتعلمها الطبيب ويكون حاذق بيها is when lots of patients have chronic illnesses. فإذا المريض مثلا خلينا نقول عنده bronchiectasis توسع القصيبات الاحتقاني وكل شهرين ثلاثة عنده infection at best إذا بلغم etc. هذا المريض can still be حال أي واحد من أفراد الشعب الجريح، حال أي واحد من أفراد الشعب. ممكن يكون عنده viral infection، ممكن يكون عنده urinary tract infection، ممكن يكون عنده cellulitis soft tissue infection. فهيكامز ديكتام يقول لك أنه المريض من يجي تاخذ بنظر الاعتبار أنه ممكن هو الفوكس مالته his known or her known chronic illness exacerbating, but you have to think about everything else as well. فدائما هاي الموازنة عند الطبيب الحاذق انه is it just one explaining diagnosis or is it multiple diagnoses? Another clue towards Occam's razor إذا واحد يعالج بس يرجع المرض and it's not recognized. يعني اكو امراض they have a trajectory that is downsloping. يعني مثلا multiple sclerosis أو غيرها، وراح تتعلمون هاي الشغلات طبعا for those of you guys who are still early in their careers. بس اكو مرات يصير انه مثلا واحد يجي قاعد عنده فقر دم مثلا iron deficiency anemia، اعطيناه حديد، اعطيناه blood transfusion، ورا فتره رجع. فأوكمز ريزر يقول لك شنو؟ انه انت لازم ترجع يجوز اكو unifying diagnosis، فلحد ما انت تفتهم ليش هو iron deficiency and you're only symptomatically giving them the iron, you have to look for the polyp اللي موجود بالبowel or whatever the bleeding source is, or maybe the reduced intake of iron because of underlying celiac disease مثلا or malnutrition, whatever it is، حتى الواحد يصير عنده unifying diagnosis. هاي ان شاء الله تتذكرونها مستقبلا، وانا بالحقيقه استفاد من عندها لحد هسه من يجيني مريض presenting وعده they have a lot of symptoms etc. I think to myself, is this just one unifying diagnosis or could this patient have a chronic illness plus something else? The other thing as well that happens after you develop that tool that gives you extensive ability to do things in a thorough manner and try and differentiate whether this is a unifying diagnosis or multiple diagnoses is pattern recognition. And pattern recognition comes with experience. There's not much you can do about that, but other than the intensity. فممكن واحد مثلا يشتغل 3 سنين طبيب، هواية مرات أنا زملائي والترينيز مالتي لما يلبد أو يحاول يتخلص من الخفارة ويتخلص من هاي ويحاول يشرد من هاي، أقول لهم you're not doing yourself any favor، لأنه أنت هاي راح تأثر على amount of learning that you get. لأنه واحدة من الشغلات اللي كلش مهمة أنه الطبيب ما يكون de-skilled. مرة أكو مستشفى موجودة بالخليج، ما أقول يا دولة، they offered me very lucrative contracts based on my CV. رح شفت المستشفى كان بيها مرضى ينعدون بالأصابع، فأنا قلت this is my recreation, I'll become de-skilled as an operator. شنو الفائدة من وجودي أصلا ومن علمي ومن كل الأمور اللي أنا قدمتها وتعبت عليها. فالintensity كلش مهم on clinical exposure. The more intensity you have, the more clinical exposure. فإن شاء الله مستقبلا لما تتخرجون واللي متخرجين وقاعدين يشتغلون when it's busy, don't be disheartened. This is a lot of learning opportunity for the person. And then with that experience, you become very slick, inshallah. You'll come across as extremely practiced, maintaining the core values of looking after your patient by explaining to them what you think is wrong is layman terms they understand, what tests you'd like to do for them, and also offer them the opportunity to ask questions or relay concerns. And then the three components كلش مهمة. بعدين يصير عند الواحد ويا experience what we call the gray case. The gray case اللي هي a number of variables that you get in somebody فلان شي ويا فلان شي ويا فلان شي معناها think فلان شي. فمثلا واحد عنده مثلا I don't know مثلا bilateral leg swelling in the context of somebody's got high blood pressure. Think it could be due to the blood pressure medication, or it could be due to heart failure, renal failure, liver failure, or chronic venous insufficiency. فأكو combined factors مثلا عمر كيت think of these things, the common things. هاي يسمونها the gray case. هاي will develop as time progresses. الشيء الثاني بالproblem based learning اللي كلش مهم انه هو problem based learning student centered. يعني احنا نريد طالبنا يبدي يعتمد على نفسه from a very early stage. فلهذا السبب مثلا نشوف أنا بالنسبة لجامعة العين أنا ودكتور عدنان وأستاذ عدنان والفاكولتي الآخرين very keen أنه clinical exposure happens at an early stage in the doctor's career. Not only it becomes extremely stimulating for them to see what their lives may entail in the future, but also it would help their learning to become student-centered. حتى إحنا بعد نفكر بالطالب إيش قد مستواه، إيش قد قابليته للتعلم، شنو الطرق التعليم اللي هي مناسبة لذاك الشخص أو هاي الإنسان المعينة. فهاي كل هالأمور كلش مهمة student-centered. ولازم يكون problem-based learning active learning to encourage critical thinking. هاي وحدة من الكواليتيز اللي جدا مهمة أي clinician بس بالذات الفيزيشن. problem solving ability كلش مهمة، خصوصا إذا المريض ما تحسن. ليش ما تحسن المريض؟ تيم ورك، لأنه راح أعتمد أنا على زملائي اللي عندهم اختصاصات أخرى، راح أعتمد على الجونيور ستاف مالتي حتى هم أنا يشاركوني بالرأي، أعتمد عليهم حتى they do مثلا the investigations run investigations of procedures safely in timely fashion. and طبعا الكادر الأوسع من هذا النيرسينج ستاف allied professions allied to medicine physiotherapists occupation therapists rehab medicine whatever. هاي كلش مهمة إنه إحنا ناخذهم كلهم نظر الاعتبار حتى إحنا we help the patient through their journey. واحدة من الأمور اللي كلش ممتازة بالنسبة problem based learning هو الجروب formation. فنحن من نسوي problem based learning يعني نقسم groups، وهاي gives us diversity in learning styles. لأن أكيد إذا إحنا نحط 10 أنا أتذكر بالكلية كانوا يقسمون randomly، حتى مو بس هم الجماعة اللي هم بس يريدون يكونون سوية دام سوية، لأن هذول هم من قاعهم هم سوية لأنه they probably think alike. لا إحنا randomly نحطهم لأنه the reality of a doctor's life they would have to work with people who might differ in their personalities, their perceptions, their qualities, their attributes, their strengths, their weaknesses. For learning styles, the background of the colleague مال الطبيب أو غيره is really useful sometimes. اليوم أنا كانوا اثنين من زملائي كانوا يناقشون فد حالة وقالوا لي مضر هذا أكو طبيب العفو مريض بس he travels to China, he travels to the Middle East, the eosinophil count مالته عالي. They were thinking could it be something parasitic. فهم the reason why they asked me is because my background is I work in different parts of the world, some more exposure to tropical medicine. فلهذا سألوني. And the same would apply. I would ask them depending on their niche and their speciality. فهذا كله احنا نحاول نعود طلابنا من وقت يتعودون عليه. بعد case presentation. The problem based learning لازم يكون case presentation. أكو clinical case scenario to initiate the problem based learning. لأنه إحنا شنو إيش قد ما راح نشجع طلابنا يابا أنت لازم تكمل cardiovascular system, the respiratory system, the gastroenterology system, whatever systems that we have to complete and learn. بس من نجيب problem based learning راح نجيبك clinical case scenario حتى إحنا initiate problem based learning. This patient presents with breathlessness. This patient presents with chest pain. This patient presents with a swelling of the neck and fever. هذا واقع حال. هيك مرضانا راح يجون. هيك مرضانا they will present. ما حد يعطي diagnosis من قبل. فالطبيب كل ما نعوده بالundergraduate years ياخذ يعني تفكيره وطريقة تفكيره in a structured way بحيث is case presentation based, working in teams of students so that they can learn of each other the skills of how they extrapolate learning. Extrapolate information. ولازم الكيس presentation يكون relevant to the student's knowledge level and skills. ماكو فايدة أنا أجيب problem based learning clinical scenario for second year medical students ومن بعدهم ما ماخذين أي شيء على الجملة العصبية أو neurology، أو ماكو داعي مثلا أعطيه الليفل كلش عالي وهو الصدق الطبيب بعد هذا أو الطبيب in the making haven't learned what they should be learning by that point. It has to be engaging to stimulate curiosity. وأنا تعمدت حطيت هذا كأنه صندوق واحد حطه بالصندوق وفتح الفتحة حتى يشوف العالم اللي هو برا هذا الشيء، لأنه one of the things that are really risky for a doctor is if they become a specialist and they don't work within teams وما يطور نفسه شوية راح يلقى نفسه بصندوق وما يدري هو أصلا بصندوق ولا راح يسعى حتى يسوي فتحة بالصندوق حتى يشوف العالم برا شنو شكله، أكو شيء آخر to explain what they have etc. وبالproblem based learning نحط الطلاب مالتنا إحنا وبعدين is relatively small groups 15 أكثر شيء، فلازم عندنا faculty هواية، والfaculty شغله to guide the discussion not provide the answers. I know the answers in my particular field of speciality general medicine or respiratory مثلا، بس أنا شغلي مو حتى أعطي أجوبة، شغلي حتى I guide the discussion حتى encourage the students to participate to keep on track. لا هاي بعيدة، ليش مو هيجي؟ حتى هو أنا أريد يتعلم ال critical thinking ability، وأحاول هم أنا كفاسيليتيتر مثلا هسه من يجون الطلاب عندي to provide everybody and ensure equal contribution. مرات أكون ناس هم طبيعتهم يحكي هواي أو يريد يبرز نفسه أو يريد يحكي بشيء، بس يجوز وحدة قاعدة هي فاهمة وهاي بس هادئة بس عندها يعني التفاصيل كلها مال الموضوع والcontribution راح يكون للجروب كلش مهم. فالفاسيليتيتر هذول اللي شوية شاي يخليهم يبرزون شوية يعطون نفسهم، وذول اللي هم شوية allowed هاي يتشكر منهم وهاي و encourages them to give others opportunity to contribute. كل problem based learning has to have clearly defined and specific aspects, objectives of learning, knowledge and in clinical skills. They have to have these clearly defined. حتى من يجي الطالب هو مثلا اكو فد problem based learning حكيت لكم example مثلا coughing up blood، مثلا passing black stools، fatigue and loss of hair loss. هاي كلها سنة من احكيها واحد هسه راح تحسونها شوي خصوصا بلداننا، بس واحد يشم ريحته طبيبي بتبدي الاشياء، دكتور شو انا مرات تحرق عندي مرات منه وهاي، فيبدي هو intrigued واوتوماتيكلي شوي يبدي البروسيسنج مال الدماغ whether هو interested whether هو يقول انا ليش قاعد تقول لي انا مو شغلي هذا الموضوع، بس they can't help it at a subconscious level it will trigger what could it be. فاحنا بالproblem based learning نحاول نكون clearly we define clearly the objectives حتى knowledge والclinical skills يكون محصور بفد موضوع معين to 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 get the best out of that particular scenario. وبعدين نقعد ويا الطلاب أول سيشن نقول لهم يابا هذا البيشنت who presents with breathlessness and swelling of the legs، زين شنو اللي ببالكم شنو اللي ما ادري شنو، يعني يبدون هم يفكرون based on their level of knowledge. ممكن second years يختلف عن ال fourth years، دول راح يعطون هواية أكثر engagement قبل لا يروحون حتى learning resources. بس كفاسيليتيتر أنا راح أبدأ يابا البريثلسنس ولا swelling of the legs، شنو السيستمز اللي ممكن نسوي breathlessness؟ يابا كيت أوكي القلب، كيت الرئة، بعد هيجي ممكن يصير واحد بالفاسيليتيشن يلا روحوا وين الريسورسز اللي احتاجها من عندكم حتى نرجع للسيشن الاسبوع القادم، text books online other references وريسورس يوتيلايزيشن اذا اكو بعدين guidelines databases موجوده learning and decision making خصوصا من تجي بالمانجمنت مال لما نفتهمنا شنو البروبلم مال البرزنتيشن المريض، ويجي بعدين وراها من يجيبون يلمون هاي المعلومات يتعلموا شويه شنو انا لازم اتعلمه من البروبلم بيس ليرنينج. هذا اللي اجاني هاي الكيس سيناريو 83 عمرها حجيه خديجه اجت قالت كيت رحنا احنا قرينا عن هذا الموضوع ورجعنا. والشيء الحلو بها انها طلاب كل واحد راح يقرا فد كومبوننت يختلف عن اخر او جزء هم بيناتهم اذا هم جروب ناجح يابا انت اقرا عن هذا الشيء يابا انت اقرا عن هذا الشيء يابا انت اقرا عن هذا الشيء. يجون بعدين اكو بروبلم اناليسيس الاسبوع اللي وراه what they know شنو تعلموا من راحوا هم درسوا وبحثوا عن هذا الشيء. بعدين الفاسيليتيتر يبدي يحاول يسويها focus what they need to know. لأنه الطبيب عنده وقت محشوك من هو يريد يسوي differential diagnosis and then manage the patient accordingly. ولأنه وقته محدد لازم يبدي هو يدور على المعلومات that they need to know. وهاي هي skill بالحقيقة تنبني عند الطبيب أو الطبيبة as they progress in their careers. What they know وبعدين what they need to know specifically for that particular individual. ورا ما كملوا هاي نجي ثالث أسبوع. هي اعتيادي 4 أسابيع هذين problem based learning cycles. نجي الهايبوثيسيس يابا شنو البوتنشال diagnoses، يعني ممكن أكثر من diagnosis، differential diagnosis، ولازم لما الجروب يعطيها مو هيك راندم يابا عنده septic arthritis of the knee جاب هاي السالفة مثلا، لا لازم based on reason or logic because they've gathered all of that information and that's why they think أنه the 83-year-old woman who has a history of blood pressure, swelling of the legs، معناها she's probably got either heart failure يا good، ممكن عندها مشاكل chronic، ممكن عندها فلانشي يعني is based on reason and evidence based من يحطون الديفرنشلز مالتهم حتى نعلمهم أنه الواحد شوية هو منه نروي باللوجيك مو راندملي يفكر هذا it must be that. بعدين ورا ما نكمل آخر سيشن نسوي فيدباك للجروب يابا شنو اللي لازم تسوونه حتى enhance future interaction، يابا انت you should listen more على كيفك بس تاخذ المجال الآخرين، يابا انت لازم شويه contribution معك يكون اكثر، يابا انت كان لازم تروح تبحث عن مثلا what non-cardiorespiratory problems can cause breathlessness، فقر دم، thyroid dysfunction whatever، شو انت ما حضرت زين وجيت لنا الجروب حتى انت تساهم بالشيء اللي انت حضرت له زين. وهم نحكي عن بعدين الابلكيشن اوف ذا كيس، وصلنا للديفرنشال المناسب هاي حتى نعلم الميديكال ستودنتس خصوصا بدايه الكارير مالتهم از undergraduates شنو الانفستيجيشنز اللي راح تفيد based on physiology و pathophysiology parameters of that illness، والمانجمنت شلون راح نقدر نعالج هذا المرض. واخر شيء we finish off the session after the 4-week session of problem based learning with conclusions، شنو هي اللي احنا تعلمناه من particular case. فهاي اكتشفوا ويا مرور الزمن there's so much out there in terms of publication that reinforces how powerful it has been to conduct problem-based learning to small groups in medical school to complement the traditional way of learning. So the take-home messages are it hasn't been a lot of science today, it was more science about medical education وليش وإن شاء الله attract you guys حتى الواحد بالبداية. أنا أتذكر أول ما استبدي problem based learning أول أسبوع I have no idea of what's going on، أصير frustrated شو تعلمت وبس يقولوا لي، وكلنا إحنا مرات واحد medical student تو مخلص الثانوية يريد spoon feeding، يابا تعطيني معلومات وفضها هسه ليش لازم أتعب نفسي وما أدري شنو، لا زين. فأنا شتيك أحس بس بعدين as I've grown older هسه بالذات I appreciate why the process itself has taught me the skills to extrapolate information and put it in a structured logical manner to be able to derive a diagnosis. لأن بعدين أنا من أطلع من medical school أنا أحتاج في شيء اللي يخليني أوصل بوقت أسرع ومور efficient للديفرنشال diagnosis بدل ما أظل أجرب أعطي علاج والله كريم أعطي علاج والله كريم. So problem-based learning is a contemporary teaching method. It's very engaging as you get used to it. It encourages teamwork ethos and it really does reflect real life medicine. المريض يجي يقول لك أنا فحطان عندي وجع ما يقول لك أنا عندي فلان diagnosis. هذا كلش useful resource. Professor Haddon الله يذكره بالخير وبروفيسور ديفيس من University of Dundee هاي الببليكيشن مالتهم، وهذا one of the tables that they extrapolated from Maastricht Medical School اللي هي تقسم الكومبوننتس اللي كنت احكي عنها بالاسابيع. اكو مرات هم يطولونها 7 اسابيع او 7 sessions twice a week مثلا على مدى مثلا 4 اسابيع. في students work in the group text problem the scenario يعني هذا السيناريو they define the problem brainstorming شو تقولون هاي reaches interim conclusions about the problem بعدين formulates learning objectives then work independently to achieve the learning outcomes بعدين the student group reconvene to discuss the knowledge acquired. فهاي حتى تطعم النولج اللي هم محصلينه سابقا، وإن شاء الله coming up هيك فد flavors بسيطة the remaining summer modules that you guys have as part of the Al-Ayen Medical College teaching platform for the clinical approach to the case اللي أنا هسه حكيت عنه وليش احنا نسوي problem based learning approach. راح يكون اكو session عن البين من أستاذ عدنان. أتصور it's going to be deferred to another date مو 22nd of September. دكتور مبارك will update you guys إن شاء الله in due course. Lump and weight loss from دكتور أديب معاون العميد, and then I will finish off with breathlessness and edema. اكو بعد كم سيشن اتصور مع الدكتور بيتر كاري جاي عن البيسكس of cardiology examination coming up, and you guys on your own platform ان شاء الله you will be informed about these ان شاء الله. وشكرا جزيلا واسف على الاطاله, and I'm happy to take any questions. Stand in silence. Yeah, Dr. Omnia.
Okay, thank you so much. So it's not a question really, it's like a comment on the presentation. Thank you so much. It was brilliant as always. I really loved when you touched the idea of like venture into your future as early as possible and do not concern yourself with the time or the effort, because I've got these negative comments all the way down, like, why do you go to this hospital? Why do you like tire yourself? Yes, you could go to this hospital. It's less effort. It's more like you have life. You don't have to spend your whole life and time in medicine. So yes, medical educationalists always look at life as an opportunity to learn. So yes, this is important for all of the listeners who are like attending the session. Start to learn from now on, because it will like cultivate the experience at the end of the road. Thank you so much, Dr. Mudher.
لا عفوا, شكرا جزيلا لك. إلا هو طبعا إن شاء الله أنا يعني هي stimulating. هو الواحد المفروض when they go into medicine اللي ناجح يكون بحياته عموما وبالطب خصوصا if they wanted to make their medical career into a recreation أكثر مما هو onerous task that they don't look forward to going to when they wake out of bed in the morning. And I don't just say this, I genuinely mean it. كل ما واحد يصنع هذا الانvironment اللي هو very productive and very intriguing, very exciting and rich in learning opportunities. طبعا مثل ما قالت الدكتورة واحد احنا من نحكي عن هذا, احنا نحكي عن healthy learning environments, مو intensity بس لا واحد عنده لا resources لا شيء وما يقدر يعطي المريض حقه. فإتس a balance between the two. But generally speaking, intensity is good, learning opportunities are plenty. وأنا واحد من الناس اللي أعتبر نفسي محظوظ because I work in both Iraq and the UK, particularly in Iraq because there was a time when I was a specialist, I was exposed to so much more respiratory medicine having a tertiary center in Nasriya, that I felt that the 5-7 years that I've had or 8 years that I've had when I've worked very, very intensely in Iraq were the equivalent at least 2-3 times of what I would have done as a consultant in respiratory medicine in the UK, which has given me the platform for a lot of my colleagues who really respect me because they feel that the experience that I've had, things that I've seen, because that's how you learn, are the equivalent to somebody who's near retirement. وأنا بعد الحمد لله شباب. But this is highlighting what Dr. Omnia says. يعني الواحد learning opportunities will make you learn quicker, thrive a lot better as well. أتصور ماكو أسئلة بعد. And if that's the case, yeah, I think we can let everybody go. Dr. Omnia, Dr. Mbarak, Dr. Omar, if he's there.
Okay. No questions in the chat, Dr. Mbarak?
Yeah.
No question.
No question.
Okay. So like this concludes the night, Dr. Mbarak. Thank you so much.
شكرا جزيلا. تصبحون على خير جميعا.
انتم بألف خير، مع ألف سلامة.
شكرا.